All right, so we'll go ahead and start. The next is on, we finished tetralogy of Fallon. Now I will be on page number 6 with rheumatic fever. And on rheumatic fever is important is on first line, how does rheumatic fever comes? Underline the word streptococcal infection. It's a beta hemolytic infection. Everyone should know rheumatic fever comes from sore throat and maybe with the answer streptococcal infection. So main thing is strep infection. What did the patient was sick before they had rheumatic fever? Maybe they were sick with sore throat and they had infection with streptococcal infection. Next line, very important. Immediately when you see your question, where does rheumatic fever affect? Underline the word, it's affecting the skin, the joints, the brain, and the heart. 4 things are very important. Where does it affect? The skin, joints, heart, and the brain. See how your question can be, where do you monitor patient when they have rheumatic fever? So it's not only the fever, but it's affecting all over the body. So first thing everyone should know comes from where? From streptococcal infection. And what do you monitor when patient has a streptococcal infection and rheumatic fever? It's affecting the skin, affecting the joints, affecting the heart, and affecting the brain. Now there may be in your question would be, is complication. When somebody had rheumatic fever, what do you monitor? Underline the word heart valves. And where is it affecting in the heart valves are, write down the word in the heart. I want everyone, mitral valves. Everyone is okay? Mitral valve. So highlight the word valves. And where is the mitral valves are? On the left side, between left atrium and left ventricle. Everyone should know where is the mitral valve is between left atrium and left ventricle. And whenever the valves are damaged, remember the word is called rheumatic heart disease or endocarditis. So rheumatic heart disease, so think about patient has rheumatic fever, but where is it affecting here? Heart. And what is the valves are affecting here is the word endocarditis inside the heart. So endocarditis. They may not give you the word rheumatic heart disease, but we all should know. Your question, when they're giving you, child has a rheumatic fever. What do you do when child is admitted? Your answer may not be anything, but answer may be give a bed rest. Why? Because the heart is damaged. And what part of the heart is damaged is the inside the heart, and that is the mitral valve. And what is the mitral valve does here? Allow the blood to go from the left atrium and the left ventricle. And what kind of blood is going here? Oxygenated blood. Page number 6, rheumatic fever. We have started rheumatic fever here. Rheumatic fever comes from sore throat. Rheumatic fever is affecting where? Heart. And what part of the heart is affecting? Mitral valve. What do you do for your patient when the heart or rheumatic fever questions are there? Remember, I will be talking intervention, the bed rest. Why? Because the blood is not flowing. And that not only the fever, but the heart is damaging. So everyone is okay. And where is your mitral valve is? On the left side of the heart. And what does it allow? It allows the fluid to go in from the left atrium to the left ventricle. Okay. Now, second line, if you go, is Ashkoff bodies, is hemorrhagic lesion. polyarthritis. And what do they have here? The joints. Underline the word polyarthritis. So maybe question, child has rheumatic fever, what are you preventing there? Joint pains, because the joints are really hurting. All the joints, if you can remember, but you know the joints are affected. Number third line is erythema marginatum word. What is erythema marginatum? They have on the skin the rashes or macule word. And next line, maybe they use the word nodules, small painless swelling on the bony area. So what is those called? Erythema marginatum word or subcutaneous nodules. After subcutaneous nodules, if you highlight the word syndrome chorea, that's very important for the brain. So what does maybe some question, sometimes they don't use the word is syndrome and they just said chorea word. And what is the word chorea is affecting the brain. And what does the patient is having problem? Aimless jerking movement of the extremity. They are shaking. And that is chorea. Facial grimacing. And the muscles are weak. Underline the word. They have fever. It's a rheumatic fever. So fever is there. Child has fever. But what is it affecting here? The skin. What is on the skin we have? Nodules. Maybe a word is nodules, word is erythema marginatum. What is it affecting on the joints? All joints are very painful. Third thing we remember, the heart is affected. What is affected in the heart? The mitral valve. And that's why child cannot do a lot of work because the heart is involved. And brain. What is in the brain? Syndrome and chorea. Now, if you guys will do question, you're going to find this answer. Child has rheumatic fever. You will ask the child, what was the reason or what did they have before they had rheumatic fever? They had sore throat. Or they had streptococcal infection. Very important, sore throat. Any upper respiratory infection, a streptococcal infection. Where does it affect here? The skin and affecting the joints, affecting the heart, affecting the brain. Everyone is all right? Fourth thing. And how do we diagnose them? How do we diagnose them? Let's go underneath with the diagnosis. It says here, elevated temperature and low-grade fever is anti-streptolysin. And the word is called ASO. The lab, the blood test is done. Second word, elevated sedimentation rate, is ESR. These two are very important. What is ESR means? Sedimentated rate. Sedimentation rate, and they're telling is what? Inflammation. So what are you looking in the body here? Inflammation. The last one, C-reactive protein. Very important, we know all these lab. ASO, ESR, C-reactive protein. What do we do? Intervention. Number one, bed rest. We got to have a patient bed rest. Why? Because of the heart and because of the pain. Are we clear? So joint pains they have, bed rest very important. Heat and cold application, you can pick up why? Because of the pain you can apply on the heat and cold application. Limit activity. Very important first answer. Rheumatic fever, rheumatic heart disease question, endocarditis word is because of the heart is affected. What do we do here is rest the patient. Are we clear? What do we do here? Rest the patient or allow the rest in between activity. That means as a nurse, you go in the room, don't do everything in one time, let patient rest, you did the bed making, go back again, give bath, and then take the patient for ambulation, whatever. Don't do in one time, but give them rest in between activities. Antibiotic is important to treat them and advise the child that when they come in contact with more infection, any child in the school, notify that. And dental hygiene is important and regular because the infection is from the mouth. So you got to take care with the dental care. Everyone is okay? I want everyone to keep in mind rheumatic fever, Number one, streptococcal infection, sore throat. Everyone should know where does it affect here, the joints, the skin, and they have the brain is affected, and they have the cardiac problem, and that's why you got to give rest. How do you diagnose them? By ESR, ASO, and C-reactive protein. You got to give antibiotic to treat the child. Next, we will move on to Kawasaki disease. That's also the cardiac. Rheumatic heart disease is acquired. What is the meaning acquired? They never had it, but it turns into the cardiac. And same thing, Kawasaki disease is a disorder and is affecting coronary artery disease. So highlight the word Kawasaki disease, underline first line, immune system. It's immune system disorder. And underline the word inflammatory, systemic inflammatory disease. So we must keep that in mind, immune system. But what happened in Kawasaki disease? Maybe there is only one answer, and maybe important answer is dilation of coronary artery. So what is it here? Dilation of coronary artery. And also underline the word aneurysm. Sometimes it says coronary artery aneurysm. Are we okay? So what is Kawasaki disease? Immune system. Second line, coronary artery aneurysm. Are we clear? So remember, coronary artery problem, dilation, and also which result in aneurysm. And what is the word aneurysm? Dilation. Remember when I talk about aneurysm, dilation. And coronary artery dilation or aneurysm word. Common age group is under 1 year or over 5 years of age. There are 3 stages. If you can remember the stages, but early sign, you remember, are underline the word conjunctival hyperemia. Their eyes are getting red. Conjunctival is conjunctiva in the eye, hyperemia, and strawberry tongue. Very important, everyone should know strawberry tongue. And the throat is red. And underline the word is lymph nodes are enlarged. So their eyes are red, and the tongue is what? Strawberry tongue. Enlargement of the lymph node, and they have red throat. Next line is important. After 2 weeks, they also start getting cracking of the lips. And they use the word for cracking, the fissure of the lips. And next problem is desquamation. Meaning is desquamation is peeling off the skin. And where are they peeling off the skin? Underline the word from the tip of the finger and the toes. The palms are red and swollen. And they have bleeding disorder, thrombocytopenia. After is 4 weeks, and child is going in 6 to 8 weeks, convalescent stage, recovery. And they look normal, and they return normal within 6 to 8 weeks. Everyone should remember few wording. First thing is coronary artery aneurysm. It's a cardiac problem. Aneurysm, immune system problem. What do you see in the child? Everyone should know a strawberry tongue. The eyes are red. Throat is red. Enlargement of the lymph node. Desquamation of the skin. From where? From the tip of the finger and the tip of the toes. And their palms are red, and they have cracking of the lips. Are we clear? And they have thrombocytopenia, means the platelet count is low. So what is the problem here is coronary artery aneurysm. Now, how do you treat them? Is important. Is IV immunoglobulin. Immunoglobulin is given. And aspirin they can give them, and soft liquid, because for the eating, and not too hot, not too cold. And if you're using lotion, you can apply the soothing lotion. And you can give them Tylenol for fever, and low-dose aspirin is given for coronary abnormalities. Mostly we avoid aspirin, but here they have to give because it's the aneurysm problem and also coronary artery abnormalities, and they might be taking low dose of aspirin. Now, everyone should know Kawasaki disease, immune system disease, and strawberry tongue, very important answer. Desquamation word, lips are cracking, the palms are red, and how do you treat them? IV immunoglobulin. Next disease, I'm going to move on glomerulonephritis. It's a kidney problem, but you don't see in the adult, but in the peds you have glomerulonephritis. When we are talking about glomerulonephritis, underline the word inflammation. Where is the glomerul word? Inside the kidney. So anytime in your question or you're reading patient diagnosis, glomerulonephritis means that the kidneys are affected. So what is glomerulonephritis? Are underlying inflammation of the glomeruli. And comes from, third line again, is pharyngitis, tonsillitis, and streptococcal infection. So infection is coming from pharyngitis, laryngitis, streptococcal, same as what? Rheumatic fever. Everyone is okay? Just like we said, rheumatic fever comes from what? Streptococcal. Everyone remember glomerulonephritis comes from where? Is streptococcal infection, and from maybe pharyngitis, tonsillitis, child has it. Now what is glomerulonephritis? Acute, affecting 2 to 3 weeks after infection, chronic, keep coming slowly, and data collection. Now what happens when your kidneys are bad and glomeruli are filtering the kidney? And what will happen is here the kidneys are affected, and what will be your filtration rate of the kidney would be low. And what does it lead to when your kidneys are bad? What do we start? We start gaining weight and edema. Are we clear? Why? Because we are not getting that urine enough output, because the glomeruli are not filtering. Underline the word. Anytime in kidney, remember the word edema. In edema, they may use the word preorbital. Around the eye is edema. Facial edema. Now what happens when the urine is low? Color of the urine is going to be darker. So in your question maybe what kind of urine you're going to see? Smoky color of urine, dark color urine. Maybe the word is hematuria. And what would be the patient is having pain. Remember, I want you sometime is pain, and child may have pain, but because kidneys are affecting, so pain would be where? In the back. And so write down the back pain, flank area pain you have, and proteinuria. So when we are talking about the kidneys, anytime kidneys are bad, what would be affecting here is the protein. Proteinuria means you start losing a lot of protein in the urine. Anytime proteinuria, your first answer start looking, are we affecting the kidneys? Are we okay? So proteinuria, kidneys are affected. So we are moving on proteinuria. Increasing BUN and creatinine. Remember, everyone should know your labs. BUN and creatinine is going to be high. Proteinuria is in the urine. It shouldn't be there, but patient has proteinuria, that means kidneys are bad. So remember, sore throat infection damaging the kidney. Glomerulonephritis, child is having from where? From sore throat. What is the early sign of glomerulonephritis? I said, remember, you are retaining fluid, is causing edema. Where are the edema? Facial edema or preorbital edema. And what is the child is having? Low urine output. And what would be the color of the urine? Would be darker. Everyone remember, glomerulonephritis is inside the kidney. Kidneys are not filtering the urine. And what is the child is having here is glomerulonephritis with a smoky color urine, brown color urine, maybe hematuria where they have protein urine, BUN, and creatinine is high. When we do renal chapter, and I said the word azotemia, you have there. Azotemia is what? What is azotemia? Azotemia word is high nitrogen waste. What is our kidney removing? All the body, you don't need the nitrogen waste from the body. And what is building up here is your nitrogen. So write down the word increasing nitrogen waste. Increasing ASO. What test do you do? Same as we said rheumatic fever. ASO, ESR. Erythrocyte segmentation rate. Same lab test. Intervention. What would you do when they have glomerulonephritis? Monitoring INO. Number one, weight is important. And what happened when your kidneys are failing and you're retaining fluid? What happened to the blood pressure? Will be high. What is the word is? Hypervolemia. When you lose the fluid, hypovolemia. So what are we retaining here? More fluid. So it's called hypervolemia. So everyone should know azotemia word and lab word and INO, and the word is here is vital sign. What is in the vital sign is very important blood pressure. What are you assessing when your blood pressure is high and you're retaining more fluid? I want you to add there, always remember when you retain fluid, your lungs are congested. Not all the time your answer would be monitor weight. What do you monitor here? Also the lungs. And what would you hear in the lung sound? The crackle. So make sure we add there is blood pressure is high, assess lung sound, and regular diet. But what do you cut down here? Limit activities. Why? Because whenever nitrogen waste are very high, it affects the patient or the child here is safety, because level of consciousness and confusion. Safety is important. And regular diet. Do you cut down when you have edema? Sodium and fluid. Remember the word sodium and write down on the top fluid. Any questions on kidney? When you're retaining more fluid, same thing is CHF, you're retaining more fluid. What do you cut down in the diet here? Sodium and fluid. What do you cut down here? We usually, it's affect the protein, but a lot of question you will not see strict protein. They use the word high quality and protein and restricted. So high quality protein. And also azotemia. Azotemia word, what is azotemia? Too much of nitrogen waste. And what diet are we restricting here is the protein. Now be clear. And what do you monitor patient whenever they have word encephalopathy? Means because the nitrogen level is high is affecting the brain. And what are you monitoring here? Write down the word level of consciousness. Are we clear? So it does. So renal question, you're going to see the word encephalopathy. So here you're monitoring for seizure. And what happened with high ICP? When you have or encephalopathy, they can go into seizure. What are the complications of the child with glomerulonephritis? Are renal failure. And what does it lead to? Encephalopathy. Everyone is okay? Few words here. Again, I want you to repeat those wording here. Streptococcal infection, tonsillitis, any throat infection lead to two diseases are rheumatic fever, we just finished, and second is glomerulonephritis. What happened to the child when they have glomerulonephritis? The urine output is very low. And what are they? Start having edema, BUN and creatinine. Everyone should remember the word azotemia word, wherever you will see, goes in the kidney. And what are you going to restrict here is the protein. And when you have edema, what are you restricting? Sodium and fluid. So that is your renal failure. So what is sore throat is causing here? When is affecting in rheumatic fever? The heart is affecting. Renal, what is this affecting here? Renal failure. Proteinuria word is when your kidneys are bad and you're losing a lot of protein in the urine. Now I will move on nephrotic syndrome. Very important. These are all everyone has to know for your exam. So it's very good. I have all those diseases in the packages, and just review a few times, do question, and you will come across and you will find those answers. What is nephrotic syndrome is? When we are talking about nephrotic syndrome, again, kidneys. And these are, in the children, is nephrotic syndrome. And what do you monitor for nephrotic syndrome babies are? They're losing a lot of protein. So remember one word, protein here. And what is in the urine here? They lose a lot of protein. Where? In the urine. So we call proteinuria. So they have proteinuria. And number two is in their blood, the protein is very low. And so highlight the word hypoalbuminemia. 4 symptoms we got to memorize. Number one, they pass protein. And what happened? Hypo. And when you see the word albumin, what is albumin? Is protein. And so what is lowering in the blood is the protein. It's called hypoalbuminemia. And number 3, if you will go on that is edema. I want you to write down the word generalized edema. Now they do have edema, but it's all over. Generalized edema. That means is their face is round, their legs, and maybe they might throw the wording scrotal area because it's all over their retaining fluid, the children. And maybe the word is ascites. So I want you to highlight generalized edema, write it, highlight the word ascites. Second line, highlight the word scrotal area. Because your questions are going to be based on edema, based on ascites, based on scrotal area. So we got to memorize they're having edema all over. And where is the edema all over? Scrotal area they have. Maybe a lot of fluid in the stomach. Maybe they have word ascites. And the last word, I want you to highlight the word here, elevated serum lipid. What is high here? Lipid, cholesterol. So lipid is high here. All right, now I want to repeat here. If we are memorizing, and I'll connect you question, how you will need to know. So when child is having is nephrotic syndrome, is a problem with the protein. And what are they losing here? A lot of protein in the urine. And what is going protein low in their blood? And what do the child is having? Generalized edema. And generalized edema means they have on the face, but remember the word scrotal area and ascites. And the fourth one I said is what would be the problem? The lipid is high. Now we need to know there's no other treatment, but they treat them by steroids. So let's go intervention. In the second line, underline the word corticosteroids and diuretics. So everyone should know how do you treat them are by steroids. And second thing, you're giving them diuretics. So we are treating them by steroids and diuretics. Now our questions are going to be a lot on your symptom and the treatment. So it looks few lines, but the questions are very wide on nephrotic syndrome. So let me go back on intervention, the first line. Because it's kidney problem, yes, you do need to monitor INO. And number 2, weight, because they're gaining weight, yes. And urine output, protein you monitor, and regular diet. So you can give them regular diet, but what do we restrict them? The main thing is sodium, and is with the child, sodium restriction, and with edema. And also you can give them is here protein continues same. You continue protein. But sodium is very important because why? The child is having edema. Protein they're losing, so you are continuing the protein the same way. Child would need the protein, so there's no restriction. But now think about the treatment we have. Weight, we already know child is gaining, is I want you to add their skin care. Elevation scrotal area, maybe in your question. And monitor the weight is important. Sodium is important. Now let's go back in a steroids question. They did not give you any question. They did not give you child is on steroids, but they're asking you what would you monitor child who is admitted with nephrotic syndrome. That means we all should know they're treated only by the steroids. So what do you monitor when you're giving us steroids? What do you monitor? Number one, what happened when you give steroid? Resistance of infection. Are we clear? Resistance of infection. What happened when you give steroids? What are you increasing? Sugar. So remember, I'm going to write down here is sugar is high. Infection. What else? Sugar, infection. Sodium. Are they retaining more sodium? Yes. And also they have edema. So sodium, yes, we have to restrict. Sodium is high, infection risk is high. Skin care, very easily they can be bruised. And diet question. Now let's see what diet are we going to cut down. Sugar, sodium, and remember the lipid was high, cholesterol. So everyone write down on the side, because of your steroids, you got to remember proper handling of the child. Because easily they can get bruising on the skin. Are we clear? Because of the steroid. And what do you give them? The skin care. What do you cut down in the diet is sodium and sugar. Do not increase. What do you monitor for the child is your sugar level. Because when you're giving us steroids, what happened? Hyperglycemia. They don't have hyperglycemia, but because of steroid, maybe the sugar level is high. You got to monitor their sugar level by doing AccuCheck, a skin care. So that covers your nephrotic syndrome. What is nephrotic syndrome? Is a massive protein problem in the child. And what are they losing here? Protein in the urine, and remember one word, the protein in the blood, which is called albumin, is going low. Child has all over generalized edema, and number 4, the lipids are high. And how do you treat them? By giving steroids and by giving diuretics. When you're giving diuretics and you're giving a steroid, you've got to monitor the potassium. Everyone is okay? Why? Because steroids is lowering potassium level, and you're giving, along with them, are diuretics, and you've got to be monitoring. Maybe your answers are monitor potassium level. Are we clear? So you got to be, remember, what is low when you're giving steroids? The sugar and sodium is high, and what gets low here? Calcium and potassium. And you've got to connect your question with nephrotic syndrome. So we are done. Nephrotic syndrome, very important that we all should know. Next is cryptocritism. In the same page, number A. What is cryptocritism? Is testes fail to descend, undescended testes. So highlight the word, is testes fail to descend through the inguinal canal into the scrotum. So the babies are born and their testes did not descend it. Now, is important for exam that we must know the treatment. How do they treat them? Is intervention, monitor for 12 months. They're not doing anything right away. And they monitor. But after 1 year of age, they start giving them hormones. And what hormones they give? Underline the word, line 3. HCG. Do not get in a growth hormones, and sometimes they throw the word in. So what do we give them here? HCG hormones. Human chorionic gonadotrophin hormones. Then you will go after you're giving that, if that didn't help, and why do you give them? To stimulate the testosterone. And if that is not done, then they have to do the surgery. We all should know the name of surgery is called orchiopexy. So everyone should know orchiopexy. You have in your notes, highlight the word orchiopexy. Because a lot of time they didn't say undescended, and they say, you have a child who is coming back from orchiopexy, and what would you do? And you don't know what is orchiopexy, you cannot answer your question. So we know when they do surgery, they descended the testes and they have done the surgery. And there may be a question, before surgery, what hormones they give? HCG. Everyone should know HCG hormone. Orchiopexy word is important. What do you monitor after the surgery has been done? Orchiopexy is, underlying the word is 1 to 2 years of age, treatment is done. Surgery immediately when they're in the hospital, you're monitoring for bleeding, monitoring for infection, and give the pain medication. But child is going home. What do you teach them here is, number one, monitor for infection, pain, and restrict the activity. Now, a lot of question may not be not to ride the bike. Yes, there are some books you have not to ride the bike, but if you do sounders, maybe the answer is restrict the activity. That's important. Why? Because they just had surgery, and they say child like to go on the bike and they can get hurt, and so restrict activity or not to ride the bike. That's okay. What else do you teach them? They must do, when they're getting older, 13, 14 years age, testicular self-exam. Why? Because it leads to testicular cancer. That's another question, common question. How do you get testicular cancer? Your answer is cryptochromosome. Are we clear? Child is born with undescended testes. And what would you teach them? Could lead to sterility. Fertility, may not be able to produce the children. So very important 3 answers here. Activities, number 2, cancer, and number 3 is for a future fertility that can be affected. Epispedia word, hypospedia word, abnormal opening on the penis when the babies are born. High epispedia located on the dorsal surfaces. Hypo means below, epi means above or dorsal. And there is abnormal opening. It's not a normal opening. Child is not circumcised. There's no problem. They can pee, but the urine is coming in different directions than coming straight. There's no other problem. But some question I came across, and there was question, child has hypospedia, epispedia. What do you monitor the child here? It says the word renal function. What are we monitoring? Renal function. So add there something to do with the kidneys, and write down on the side, if the child is born with that hypoepispedia, check the renal function. The kidneys are functioning. And what would you be, tell the mother? Usually the male child, they do the circumcision, but here circumcision is not done. And what do you tell the mother? Circumcision will be done later, maybe around 16 to 18 months. Surgery may be done before the toilet training. And urinary diversion, maybe the child has or stand. Notify after the surgery if there is no urine drainage, or check for the king, and monitor for infection. Dressing removed 4 days after the surgery. So surgery can be done, the repair and circumcision, and they use that area, the skin, to cover those opened area, and they do the surgery finally for the babies to make it work normal way. So everyone should know the word cryptochromosome. Everyone should know cause testicular cancer, and can be complications, sterility, or future fertility answer may be there. Hypospedia, epispedia word is very important to know abnormal opening, and mother react abnormal, they're upset, the child is not normal, that's okay, give them support and tell them the circumcision will be done later. The next is the word is bladder extrophy. What is the word bladder extrophy? Is urinary bladder extrusion. Bladder is coming out, extrusion of the bladder through the lower abdominal area. So this is abdominal area and extrusion of the bladder. So when you see the word bladder extrophy, the bladder is out. And data collection. Sometimes how the wording of questions are, and they're saying, what do you monitor? Are exposed bladder. You can see the bladder outside. And what would you see here? The symphysis pubis. Our bone here is the symphysis pubis. Bones are widened pubic area, and the bone wide because the bladder is pushing out. Everyone is all right? So what would you see when the child has bladder extrophy? Could be answer are widened symphysis pubis and defect in the external genital. Not only the bladder, look if they're really normally male or female. Are we clear? So could be a genital area external defect. So may not be developed good. So child is born with bladder extrophy. What do you monitor? And answer may be look for genital area. Look for symphysis pubis, which is widened. So those are your questions. So make sure we highlight. What do you do as a nurse? Prevent the bladder tissue from drying and also allow the drainage of the urine. Bladder covered with underline the word, adherent, clear plastic wrap. Again, you don't want to get the stick, so use the plastic wrap or thin film dressing without adhesive. Do not take anything with tape. Do not take petroleum jelly. That's not good. And avoid it because it tends to dry and damage the delicate tissue. So bladder extrophy, let me remind everyone, the bladder is coming out. How do you cover them? Remember the word cover them with normal saline or sterile dressing, but use the word plastic. Do not pick up your answer petroleum jelly. And enuresis means the bladder control age 5, and they are able to control the child. I will move on to the next disease. Is all diseases are very important and you guys have it, but make sure you review them before you're taking exam and start doing questions. Your Saunders books has a lot of questions on Peds, and I'll tell you, even after you have done so much, the way the wording are, you will still miss, but that's okay. I would advise you to do a lot of questions on that. Now, epiglottitis question. What is epiglottitis? Is infection. Underline the word, it's emergency. Any question you see when you're doing epiglottitis is an emergency. And what is the reason for epiglottitis? Underline the word influenza. Hemolytic influenza. So H influenza, very important here. And when do they give vaccination? 2 months of age. So in your question, teaching question, prevention question, how do you prevent is epiglottitis by giving them influenza vaccine. Next is, what do you see in the child who is admitted with epiglottitis? Underline the word is drooling. They're drooling and inspiratory stridor word. So epiglottitis means the child is not able to breathe. Are we clear? So everyone, when you see your question, what is epiglottitis? Severe breathing problem. Child is having what? A stridor. Whenever you see the word stridor, they cannot get the air. They are not able to get the air inside. Position. How would you see the child like to sit? Leaning forward. Thrust the chin forward. They put chin forward. Open their mouth and attempt to take air. So what is the word is called? Tripod position. They're resting, sitting, and leaning on the table, and they open their mouth. Why? Because they're not getting air. So question, what would you see, child, when you're admitting with epiglottitis? They're sitting in tripod position. They open their mouth to breathe in. Remember the word stridor, they're struggling to breathe. So what is the problem here? Epiglottitis, infection of epiglottis. And how do you prevent them? Very important, influenza vaccine. And what would you see in the child? Tripod position. What are they doing? They're opening their mouth and they're breathing through the mouth. Next line, supporting their hand and arm. They're sitting and supporting. And epiglottitis means they have infection. So highlight the word fever. They're having high fever, they have infection. And a spontaneous absence of cough, but cherry red epiglottis. When you're looking in the mouth and they're inside, the glottis is red, inflamed, infection, and fever. But what is it causing epiglottis? They can't breathe. So what is epiglottitis? 3-4 word is important. Tripod position. They're opening their mouth to breathe in. And what is the biggest problem they have? A stridor. They cannot breathe in. What do you do? Intervention. What is your priority? Airway. Next is avoid agitation. What is the meaning agitation? Don't let baby cry. Let the mother stay with the child. Don't force anything with the child, because why? They're only breathing through the mouth. So avoid agitation. Caregiver. Whoever is with the child, let them stay with them. No oral temperature. No oral culture. When you come across in question and the child is admitted epiglottitis, doctor has ordered culture, question it. Don't do the culture. You can't go through the mouth. So remember, that is very important. And do not restrain the child. Do not force the child to lay down, because they are only breathing through the mouth. Next is Tylenol, if you're giving, maybe rectal, suppository, cold mist oxygen therapy. They're needing oxygen, cold is good. High humidification. Any question in breathing problem is high humidification. You are humidifying and liquefying the secretion. So is good answer. Cold is good. What do you give them? IV fluid. Antibiotics started right away. As soon as you start antibiotic, within 24 hours, child may start responding and getting better. So antibiotic would be given to the child. What do you keep in the room? Resuscitative equipment. You will keep them in the room. Intubation. What do you teach the mother? To give Haemophilus influenza vaccine. Everyone, very important for NCLEX is epiglottitis. You do have epiglottitis in your Spider-Man packet is contact precautions. Are we clear? So droplet, not contact, droplet precautions, epiglottitis. So epiglottitis, when you are going through with the Spider-Man package, you have a lot of isolation. Lot of isolation you do have from Peds there. So remember, one of them is on droplet acute epiglottitis. Now I will move on. The next problem with the babies are. So remember, no throat exam. Keep that in mind. Influenza vaccine, very important here. And do not force the child. Next is bronchiolitis and respiratory syncytial virus is in your exam. Very important. All we need to do, all your books have your question. We all need to know bronchiolitis word or RSV word. RSV is common cause of bronchiolitis and lower airway infection. What is the problem here? Airway infection. What do you, it is caused by is children under 2 years of age is common. Underline the word virus. So what is respiratory syncytial virus is? It's an adenovirus infection And then you go is not airborne. Highly communicable. And where do we go next line? Contact precaution. Everyone, make sure we know the precaution, and when we are doing in the packages, remember we connect your question. And RSV is bronchiolitis, same. Remember the word direct contact. Remember the word adenovirus, parainfluenza virus. It's a viral infection. Now, clinical manifestation. What is in respiratory syncytial virus the child has is non-productive cough, meaning there's no phlegm. They're coughing. They're coughing, dyspnea. Again, breathing problem. You hear wheezing. And what do they have? Nasal flaring. And second line, the word is retraction. What is the word retraction means is that all the sternal retraction, intercostal muscle, what are the meaning is they can't breathe their own, and they're using a lot of muscle to breathe in. So what is the word is here? Severe respiratory problem. And they have their cough, they're not having much phlegm, non-productive cough, very important. Dyspnea is there. And remember the word is sternal retraction and nasal flaring. Tachypnea means they're struggling to breathe, and air hunger. So what is respiratory syncytial virus? Everyone remember the word respiratory, severe respiratory distress. They're coughing, they're not having any phlegm. And what would you do? Because how do you diagnose them? I want you to write down the word nasal and pharyngeal secretion. They can take the nose and throat swab, and they can do the culture. So diagnosis can be done nasopharyngeal secretion. And next is intervention. Because of the airway, your position is underlined, raise the head of the bed, is 30 to 40 degree with neck slightly extended. Flexion is going like this, extension means going backward. So when you are having a difficulty in breathing, you want to open the airway. So the breathing is what? More semifowlers and neck slightly extended. That's okay? Open the airway. Cool humidified oxygen. They need oxygen, but how? Cool humidified. IV fluids are given. Where do you keep isolation? Single room. Or maybe you can put two together. Hand washing and wearing the gowns. What kind of precautions we said you will have here? Contact precaution. Very important. Everyone should know RSV, immediately contact precaution, hand washing. Any questions on contact precaution? Number one, they're going to ask you, what is your priority here? Hand washing. And next is the medication. We all need to know this. Ribavirin or Verisol. What is ribavirin is how do you give them? By, underline the word, by aerosol, by breathing, by hood, tent or mask, or tubing. That may be your answer. How do you treat RSV? By giving what? Ribavirin. How do you give ribavirin? By breathing treatment, maybe by tubing, maybe by hood. And no pregnant person should work with the child. And not do you, if you're using contact lenses, use the goggle because they dissolve them. So number one, ribavirin, breathing method treatment. Number two, remember, no pregnant person. Next is prepare immune globulin. Everyone should know the word RSV, immune globulin word, or pulvazim. What is a pulvazim is you are giving preventively, prophylactically. Second line is prophylactically, to prevent this disease. So how do you prevent them? In any question, respiratory syncytial virus, maybe your answer, either immune globulin, but 90% I have seen question and they have the word pulvazim. So highlight both the wording and prevention. And do not give if the child has congenital heart disease. So very important, we all need to know is RSV, precautions are contact, ribavirin word is important here, and that is the treatment. What is the child is having problem? Airway problem, breathing problem, and they're struggling to breathe. Epiglottitis, I said, infection in the epiglottis. Let's take a break, and then we'll move on to the next page.